Hey guys, good evening. I was going to say good afternoon, but good evening, everyone. Welcome, October 25th, guys. October 25th. Yes, welcome to our seventh episode of Health Tea with Dr. B. Welcome. How you guys doing tonight? Hope you guys are doing just fabulous. We are already on episode 7 this week. Time is flying. Let's make it count. You guys, I enjoy doing this every Wednesday because I love educating. The amount of preparation that it takes it's a lot. It's a lot. It's a lot, but I truly enjoy it because I know what is happening. I'm getting phone calls, emails, and texts about people who are watching the show, and they have questions. And that was the purpose to have you guys ask questions about what is going on. So, last week on Health Tea with Dr. B, we discussed who was really in control of our health and who are the gatekeepers. We found out that we are our own teacups, our bodies, our minds are our own teacups, and that there are so many kettles out there with tea for us to drink. Each kettle represents a medical or health professional with medical advice and or recommendations. However, we are ultimately responsible for what we pour and how much we pour. Then with whatever we pour, we are responsible for the temperature, meaning we are accountable for its results. We even had a guest last week, which was a shocker. I was super excited, but we had a guest last week, one of my patients, who came on the show to give us her testimonial. She even explained how she managed her cup and the benefits that she had been experiencing. It made all of us reflect on who's really pouring into our cup. So I ask you all tonight, who is pouring into yours? Okay. It is something to think about because at the end of the day, the goal is to advocate. The goal is to make sure that you are able to advocate for your own health, right? It's important. It is important. And do not let anyone tell you different. Okay. So I have a few updates. Super excited. A few updates to provide about the future of this podcast. So we have been doing so well and getting amazing responses. As a result, we decided to host an in-person event every third weekend of each month so that we can link up and network and really discuss the issues that are out there. It's not just everything being online. You guys get to meet me, I get to meet you, and we get to gel and bond. All right. So that means as a result, the podcast will be 3 times out of the month. Super exciting. But more details will follow next Wednesday, November 1st. And also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram at Health Tea with Dr. BDMP or even on Facebook. Or you can send me a message at bit.ly/ Health Tea with Dr. B. And remember, if you are in Maryland, Washington, D.C., Colorado, New Mexico, and Washington State, and you are seeking treatment, the link is in my bio. Again, it is bit.ly/ Health Tea with Dr. B. If you are not in one of those states that I mentioned, feel free to reach out and I can link you to other specialists. Now, let's move on to episode 7, Scratching the Surface, Eczema Uncovered. And as usual, I have some hot tea for y'all tonight. Okay. So now y'all know, again, I'm like a broken record. I introduce a tea every week that is always going to be beneficial to our health. And it's usually loaded with benefits. Okay. So this week's tea is turmeric ginger tea. Beautiful color, right? Beautiful color. All right. I still have the tea bag in here. All right. So, turmeric ginger tea is a popular herbal drink made from turmeric, which is a bright yellow orange spice, and a ginger. So, that's a knobbly root with a pungent taste. Both ingredients have a long history of use in traditional medicine and are known for their anti-inflammatory and antioxidant properties. So here are 5 major benefits of drinking turmeric ginger tea. All right, and before I get into that, let me taste it first. So not bad. I'm not sure if you guys had turmeric before, but it tastes just like it with a hint of ginger. And I did add monk fruit in it just to kind of give it some sweetness, and not bad at all. So let's get into the benefits. Anti-inflammatory effects. So turmeric contains curcumin, and it's a compound known for its potent anti-inflammatory properties, and it can help reduce inflammation in the body, which is crucial since chronic inflammation is linked to various diseases. This is why when you guys come into my clinic, I always stress inflammation, inflammation, inflammation. Ginger also has powerful anti-inflammatory effects and can help alleviate symptoms of inflammatory conditions. The second benefit is antioxidant properties. So both turmeric and ginger are rich in antioxidants, which can help neutralize harmful free radicals in the body. So they can help us look a little younger. The antioxidants can contribute to better overall health and reduce the risk of chronic diseases. Okay. The third benefit, digestive support. I'm sure many of us deal with digestive issues, and I always go straight for ginger. Ginger is a well known root for its ability to alleviate gastrointestinal irritation. It helps to stimulate saliva and suppress gastric contractions as food and fluids move through the GI tract. And it can also help prevent constipation. So, my people out there who are always talking about constipation, ginger is what you need to do. You need to take it. And turmeric may also promote proper digestion and reduce symptoms of bloating and gas. All right, so that's just FYI. And then pain relief. This is where I love to speak about turmeric and ginger. Ginger has analgesic properties, and it can help alleviate the pain, including menstrual pain, headaches, and joint pain. And the anti-inflammatory properties of both turmeric and ginger contribute to their pain relieving effects. So those who are out there experiencing joint pain and headaches, I just had a few patients come in today for headaches. Turmeric ginger tea. And lastly, immune system boost. So the compounds in turmeric and ginger have immune boosting properties and can help enhance the body's immune response. So if we drink this regularly, it may help to prevent infections and improve our overall immune function. So everybody, let's think about the state of the world today. I'm seeing so many people being hospitalized for RSV, COVID. COVID is making a comeback. Flu, head colds, allergies. I'm telling you, turmeric ginger tea. The link is in my bio, or you can go directly to bit.ly, and that's bit.ly // health tea with Dr. B. Okay. Here are some additional benefits that the tea may have. So we have cardiovascular. It can help manage your blood sugar level. So that's for my insulin resistance people, diabetic people, and it may also provide mood enhancing properties. But please note, I just like to highlight these teas. It does not mean that it will cure anything. Okay. So this is just an aid. This is just a supplement. However, if you are pregnant, nursing, or taking any medication, please consult with a healthcare professional before making any changes to your diet or health routine. All right. Hope you guys got that. And now we are on to episode 7. Now let's sip, listen, and thrive. All right. So it looks like we have a few people on from different channels. And just remember, we highlight this on YouTube. We also highlight it on True Phoenix Community Care and our personal page, Health Tea with Dr. B, the NP. And now you can also go to the link directly and be in where I'm sitting right now. Okay, so let's move it on. So today we are going to address the root causes of eczema. October is Eczema Awareness Month, and I wanted to highlight it before this month is over because eczema is more than just skin deep. When we hear or think about eczema, we think of dry, flaky, itchy, and inflamed skin. I know personally, I think of hydrocortisone, triamcinolone. I think of flare-ups. I think of childhood. I think of asthma. I think of all of those things because this is how people present to me in my office, right? But we never think about what a person is truly going through when they have eczema. Have you ever seen anybody who has severe eczema to the point where their skin is bleeding, where they're in pain, or where treatments just do not work? All right, so that is what we're going to discuss today. So, what is eczema? Eczema, or you may also hear of atopic dermatitis. It is a chronic skin condition that affects millions of people worldwide. Okay. We are addressing this tonight because addressing eczema is an opportunity to raise awareness about the condition, its impact, and the available treatments. So, remember on episode 1, I said that I'm always going to highlight the most common conditions that are fallen by wayside. Even though it's the most common, sometimes it's the most undertreated because it's not understood. Okay. So it is estimated that over 30 million people in the US have some form of eczema. And worldwide, eczema affects approximately 20% of children and up to 3% of adults. So most cases, about 85% of kids, they develop eczema before the age of 5. All right. So we usually see newborns and babies and toddlers with eczema. And half of those children, or half of those affected as children, continue to have symptoms as adults, though the condition may be milder or more intermittent. So when I have those who come into the office with asthma or eczema, they'll say, "Oh, I had it really bad when I was a child, but now that I'm older, I'm better." Okay, so it never really goes away. It's sometimes just lying dormant, and it's just needing a trigger for it to rear its ugly head. Okay, so eczema refers to a group of inflammatory skin conditions that are characterized by red, itchy, and inflamed patches on the skin. It is a non contagious condition that often begins in childhood but can persist into adulthood. Now, this is the T. It is non contagious. I say that because many of us believe that it is contagious. All right. Now, if you aren't one of them, then good. But there are so many people out there who think that you can catch eczema from someone else. Okay. Did you know that there are 7 subtypes of eczema? You have atopic dermatitis, you have contact dermatitis, you have dyshydrotic eczema, neurodermatitis, nummular eczema, and seborrheic dermatitis. While each type of eczema has unique triggers, it is possible to have multiple types of eczema at the same time. Isn't that crazy? I know, just being in the medical field, we never thought that they combined, right? I never thought that you can have atopic dermatitis and contact dermatitis all at the same time, but you can, and they all present differently. So now I'm going to go through each one of them briefly and just give you the signs and symptoms of all. So atopic dermatitis, this is the most common form of eczema. This is the one that often starts in childhood. And it's a part of the atopic triad, which includes asthma and hay fever, right? So whenever you go to the doctor's office and you say, "Hey, I have eczema," they would usually follow up and say, "Do you have asthma? Did you have hay fever as a child?" Because it all comes in together. So atopic dermatitis, asthma, hay fever. Atopic dermatitis also occurs in patients with a personal or family history of allergic conditions. And with atopic dermatitis, you'll see dry skin, itching, redness, inflammation, and it usually forms on the arms, legs, and the face, especially the face, especially on the cheeks. All right. And then we have contact dermatitis. So it's just that contact. It occurs when the skin comes in contact with a substance that occurs or that causes a rash-like reaction. So that's like poison ivy. So you may get an itchy red rash that sometimes blisters or bumps. So it can be caused or triggered by nickel, certain fragrances, lotions, perfumes, and poison ivy. All right. And then we have dyshydrotic eczema. So this one we rarely hear about, but is very common as well. It affects the palms of the hands, soles of the feet, and sides of the fingers. They are super itchy. So it's small, itchy blisters, and it's often associated with seasonal allergies or stress. All right. So right in between those fingers, dyshydrotic eczema. And then we have number 4, nummular eczema, which is characterized by round, coin shaped spots on the skin. Now, it should not be confused with ringworm, okay? So, round, coin shaped spots on the skin, they're usually itchy, scaly, and inflamed. And it's typically occurring after a skin injury like a burn, abrasion, or insect bite, okay? And then we have seborrheic dermatitis, which mainly affects the scalp. And it can also occur on oily areas of the body, such as the face and the chest. So, what happens? How do you know if you have seborrheic dermatitis? Stubborn dandruff, scaly patches in the scalp, red skin. Okay. And then we have neurodermatitis, which is similar to atopic dermatitis, but the itching and irritation are localized to only specific areas. So thick, scaly patches are on the skin. There's intense itching, and it's particularly during the night. Whereas atopic dermatitis, it can kind of be generalized all over, but neurodermatitis is usually to one particular area. And lastly, we have stasis dermatitis, which usually occurs on the lower legs, and it is related to circulatory problems. So you may have swelling around your ankles, redness, scaling, and itching. So over time, this skin may darken and become thicker. So have you ever seen, let's say, someone who's older who comes into the hospital, or your grandparents, and you realize that their legs are generally swollen, and around the ankles it's usually pigmented darker. It's really dark and dry. That is stasis dermatitis. Okay, so we've all seen this at least once in our lives. So now you have a better idea of what they look like. Okay, so why am I speaking about this today? Yes, there are 7 types of eczema, but now I want to know the root causes. I need to know why. Why do we have it? All right. So here are a few root causes, which means this is where it stems from. Gut dysbiosis, which is an imbalance of the microbiome in the gut microbiome, where harmful bacteria outnumber the beneficial bacteria. Okay. So we have all of these strangers, let's call the strangers bad bacteria, entering our systems, right? And they're just taking over. It's like an unwanted or uninvited guest, right? These uninvited guests are contributing to inflammation, and it's creating an overactive immune response, which triggers eczema flare ups. So when you hear people say, or in response to, you might say, "Ooh, my skin is breaking out. I'm starting to itch." Sometimes we may say, "How's your gut doing? What's going on? Are you having abdominal pain? Any diarrhea? Any constipation? Have you been off?" We are directly asking you about an imbalance in your gut, because gut health plays a role with how our skin looks. So if our skin looks a certain way, let's check out the gut. Okay. And then we have stress. I know we always hear about stress, but stress really plays a role in a lot. Okay. Stress will have our skin breaking out. So that's physical or emotional tension that can trigger our body's fight or flight responses. So when we're constantly in fight or flight, our immune system is weakening, and so is our skin barrier function, which makes our skin more susceptible to irritants and infections. So that's super important. And now, environmental toxins. Yes, the environment plays a big role. And sometimes our environment, or those who are in control, aren't as honest with us about what's in our environment. So, harmful substances found in the environment, such as pollutions, chemicals, and irritants, they can actually cause us to have eczema. So, this exposure can damage our skin barriers and trigger, of course, an immune response and contribute to eczema symptoms. So, think about it. When you're sitting in a room, a classroom, or an office, and you notice that that is where you cough the most or itch the most, think about the air quality, right? The air quality is usually off. So you see, it can be something as simple as that. And this is one thing that we have never discussed, or things that we've never heard before. A root cause is an FLG gene mutation, which is a mutation in the filaggrin gene, which plays a crucial role in maintaining the skin's barrier function. So when there is a mutation, it leads to a compromised skin barrier, making the skin more susceptible to irritation and infection, which is a common factor in atopic dermatitis. Now, I'm 1,000% sure that if you've ever been treated for eczema, no one has ever asked you about an FLG gene mutation, and they probably never will. Okay, so this is just for your benefits, just so that you know what the root cause is. All right. And then food allergens. So specific foods can trigger an immune response to some individuals. And that means it can cause inflammation and exacerbate eczema symptoms, and particularly in children. So let's think about sugar. Let's think about dairy. Let's think about gluten. All right. And then, of course, we have our nutrient deficiencies. So, lack of essential nutrients in the diet, such as our vitamins, minerals, and fatty acids, they can impair our skin health and contribute to eczema. So, what kind of nutrient deficiencies? We have vitamin D deficiency or a deficiency in omega-3 fatty acids. Okay, so the funny thing is this: I don't think our parents truly understood why they told us to eat our vegetables. I think it was just something that was on repeat and on demand. But honestly, our fruits and vegetables really do contain the nutrients that we need in order for full body health. Okay, we need it. And for the past 6 and 7 weeks, we've discussed how nutrients are super important to our immune system and to our overall well being. Okay. And then lastly, we have the DAO deficiency, another root cause that I'm sure you guys have never ever heard about, and you probably won't unless you are in the functional medicine community or unless you listen to this podcast, right? So DAO, diamine oxidase, it is an enzyme that breaks down histamine in the body. So a deficiency can lead to elevated histamine levels, which will result in increased itching and inflammation associated with eczema. So that's why when we go to let's say, the pharmacy, we try to get antihistamines, right? Benadryls to help us to stop the itching. So if we have a DAO deficiency, we're going to itch even more. So you see how we link that together? All right. So, how is it treated exactly? So, once it is presented to a medical professional visually, you are then diagnosed. That is it. And usually, conventional treatments primarily focus on symptom management rather than addressing the underlying causes, unfortunately. All right. And so, when we think about conventional treatments, we think of triamcinolone, hydrocortisone, shoot, Dupixent, which is a heavy duty medication to treat eczema. But there are so many people out there who are living with severe cases of eczema that they need more than just the topical steroids. They need injections in order to have a quality of life. Okay. So in conventional medicines, um, they've tried to explore different alternative approaches, such as therapeutic diets and dietary supplements and other complementary interventions to correct the underlying causes of eczema. Um, they're still working on it. So today, we're going to try to change our mindset on how we can treat it without heavy duty medications and without the creams. So, what makes what we do any different? We are looking for the root cause of why it exists in the first place. And then we are looking for personalized treatments and approaches because each person presents with eczema very differently. Okay. So let's talk about how we try to figure out what you have first. So it may be a bit gross, but we do try to perform a comprehensive stool test. Stool, yes. So number two, when you go to the bathroom. So a comprehensive stool test actually helps us to measure any biomarkers to evaluate you for intestinal dysbiotic patterns and intestinal inflammation and intestinal permeability that may influence gut and skin barrier functions. Okay, so that's a really important test because we are getting direct samples from your gut to see what's going on. And then usually we check your allergies, and that's a comprehensive IgE panel that screens for allergic responses against environmental and dietary allergens. So there are people who go to the allergist and they get their allergy test done. There are some people who do not have access to these specialists. So that's why I always recommend for people to fill out a consultation form because I will be able to have a comprehensive stool test order for you and even an allergy test that will measure the responses against environmental and dietary allergens because there is a significant correlation that has been noted between C. albicans IgE antibodies and the severity of atopic dermatitis. Okay, so additionally, skin manifestations improve with antifungal therapy. Therefore, C. albicans, which is a fungus, C. albicans IgE antibodies should be ordered along with your IgE panel. I've never really seen a C. albicans IgE usually ordered when they do the IgE panel, but that is something that should be explored. So if you're interested in that, again, bit.ly/health tea with Dr. B, book a consult with me because I can get this order for you. Okay. And so again, we are wanting to focus on personalized treatment. Each person, again, presents with eczema so differently. So, why are we trying the one glove fits all approach? We shouldn't. So, how I usually treat my eczema patients, I recommend a micronutrient test, right? So, what is a micronutrient test? It is a test that screens for deficient or suboptimal levels of nutrients such as vitamin C, and zinc. And we know those two vitamins are required to help us combat inflammation and promote healing within the skin. It is, I mean, it tests almost every vitamin known to man in your body, right? So certain nutrients are known to be essential for skin health and reducing inflammation. And nutrient deficiencies, and I'm not sure if you guys look at the post that I post usually right before our podcast, but nutrient deficiencies are root cause and they may result from impaired gut function, dysbiosis, and dietary restrictions. So you see how everything kind of links in together. So if you have gut issues, then you're going to have nutrient deficiencies, right? And now another test, food sensitivities. So children with eczema commonly have delayed reactions to food sensitivities, and that's usually including dairy, gluten, and eggs, like we discussed earlier. So sensitivity testing can confirm the presence of food sensitivities that are therapeutic, so that a therapeutic elimination diet can be initiated. So that is the purpose of a food sensitivity test. It is a blood work panel, and again, all you have to do is send me a message, and I can tell you how to even get forward with that. All right, because you would need to know what foods are causing the issue so you can even eliminate it. Now, after we go through those two different testings, the micronutrient and the food sensitivities testing, I'm sorry, my tongue is so tied today. Sensitivities, that's the word I'm trying to say. I go into now diet approaches. What can we do? Eliminate sugar. Sugar is the devil. Sugar is the bad guy. Sugar is the stranger. I can personally let you know that I am allergic to sugar, but sugar is like a drug. It's very addictive. But sugar is not my friend at all. Sugar does a lot of things. Sugar breaks me out immediately. As soon as I put sugar into my body, my skin changes. Okay? The elimination diet. It's very interesting, but an elimination diet is generally recommended for about 6 to 12 weeks. Okay. And this is where we eliminate highly reactive foods from your diet. And these diets are usually focused on nutrient dense and anti inflammatory. So we have fruits, vegetables, omega 3 fatty acids, and fermented foods. These help to reduce inflammation, support immune function, and promote a healthy gut microbiome. So the elimination diet is pretty intense, but it's worth it if you think your eczema is not off to a good start. And again, this is for 6 to 12 weeks. So this is life changing. Um, I also instruct my patients to do or use aloe water. So you drink about 4 ounces twice per day. You can get aloe water actually from Amazon. It has no taste at all. It's plain aloe water twice per day to help coat the gut. Okay. So now let's talk about treatment options now that we've gotten the diet out of the way. So, a combination of oral and topical supplements can usually be prescribed to reduce symptoms of eczema, and it helps to treat the dysbiosis, the leaky gut, and help to regulate the immune system. So, the first supplement is called butyrate. So, what is butyrate? It is a short chain fatty acid that is produced when the beneficial bacteria in the gut ferment dietary fibers. It plays a huge role in maintaining our gut health, and it has various systemic effects on the body. So, depending on the brand that you get, you should take butyrate, one dose, which is one tablet, 3 times a day, 3 times per day with meals, and is usually for 12 weeks. So, a longer course. Remember that supplements are usually not meant to be taken forever, right? It's not meant to be taken forever. It's usually just a 12-week course, 4 weeks, 6 months, and that is it. Okay. And now the second treatment, virgin coconut oil, right? That good old coconut oil. I have coconut oil at my bedside all the time. So why? Because the emollient effect of coconut oil has been demonstrated in patients with atopic dermatitis. So when you apply coconut oil twice per day for 1 month, 95% of patients with atopic dermatitis, their flare ups decrease. Any signs of Staph aureus, which is a skin infection, that decreases by 95%. That is amazing. Like, we already have this within our reach. You can get this from anywhere: Sam's Club, Walmart, Rite Aid, Walgreens. Additionally, coconut oil has a natural antimicrobial property that supports a healthy balance of the skin's healthy microbiome. So, virgin coconut oil, I kid you guys not. I use coconut oil literally every day. And prior to me using it, I always had itchy legs. I always blame the weather, but I always had itchy legs, itchy skin, just dry skin, dry, itchy skin. And when I started using coconut oil, all of a sudden my skin has reversed. So I kid you not, this is tried and true. Now try it twice per day just for 4 weeks and see how it goes. And now you could add lavender or peppermint essential oil to the coconut oil for an added anti-itch, anti-inflammatory, and antimicrobial property. Okay. And now the next supplement, L-histidine. So L-histidine is essential for the synthesis of FLG. And remember, we spoke about this earlier. So it is responsible for the production of FLG and for regulating the skin's moisture content. So when we supplement with L-histidine, it has been shown that there's a 34% reduction in atopic dermatitis severity and a 33% reduction in topical corticosteroid use by patients. So what does that mean? And basically, it just means that when you take L-histidine, you will not require hydrocortisone or triamcinolone. And even though you are going to have atopic dermatitis, it will just probably be mild or dormant, and you probably won't have a flare up again. So, how should you take L-histidine? 2 grams twice per day for 1 month. So, you see, the course is very short, very short. And now, lastly, vitamin D. I feel like vitamin D plays a role in everything. We've been speaking about vitamin D literally since episode 1 with PCOS, hair loss. We had a vitamin D episode, optimal versus suboptimal. So we've had a lot of talks about this. But lower serum vitamin D levels have been associated with a higher rate of bacterial skin infections. And vitamin D supplementation has been shown to reduce the clinical signs of eczema. So that's interesting. So, how much? They say 2,000 international units daily for 12 weeks. You guys already know that I'm a fan of the 5 to 10,000 units per day, but try it. Try if your levels are between 60 and 100, try the 2,000 international units per day. Try it. It won't hurt, right? And things outside of supplementation, as far as topically and orally, there is light therapy for eczema. So, phototherapy, also known as light therapy, is a treatment modality that utilizes specific wavelengths of light to manage eczema symptoms. So, you can use or get UVA or UVB rays. And the research has shown that phototherapy actually reduces inflammation, itching, and scaling associated with eczema. So I would actually recommend this to one of my patients who had atopic dermatitis in a severe form. Okay, it is safe, it's well tolerated, and it's usually effective when administered 2 to 3 times a week for at least 1 to 3 months. So there is no skipping out on this one. Okay. All right. So that is atopic dermatitis, or that is eczema. All right. So again, just to recap, this segment was truly on eczema, the most common skin condition that many of us have, but few of us truly understand. Okay. Because again, when we hear about eczema, we always think about topical things, topical steroids or oral steroids or injections. It does not have to go that far. You don't have to do that. You don't have to do that to yourself. Okay. Honestly, everything that we need is within our supplements, but you have to find a provider who is literally on the same page as you. So there's nothing wrong with going to a mainstream provider at all. If that is what you choose, that is what you choose, because at the end of the day, we're just here to make sure that you are choosing what is best for you and your health. Okay? Now that is the T. I don't force anyone to do anything. I just want you to be the best you. And if you think that, getting this information is the best you, then that is what it is. I should be using a handle, but I'm so used to, being different. But this tea is actually pretty good. I'm not going to lie. That's actually pretty good tea. All right. But thank you all for joining today's episode about eczema. Remember, October is Eczema Awareness Month. I'm always going to highlight some sort of awareness. So just remember, on this podcast here, we're talking everything health. All right. Everything wellness. So even things that we do not think about, we are always going to talk about it. Okay. If you guys have suggestions, if you guys want me to try just like a tea, you've been trying to try a tea and you don't have the guts to do it, let me know. Send me a message. If you guys want to send me tea, send me a message. I actually had one company send me over 50 bags of tea for PCOS. So I have some tea that I should be giving out soon. So we're going to have some giveaways. So again, next week, please stay tuned because we're going to have really exciting updates. Our podcast will be 3 times per month, and that is because on the 4th week of that month, or the 3rd week, excuse me, we're going to have in-person events where you guys get to meet with me personally. We get to sit down, we get to gel. But again, This would not have been possible if I did not have the support. So I always want to thank you all for supporting Health Tea with Dr. B. Please follow us on Facebook, follow us on Instagram, follow us on YouTube. We're still a rather new show, but thank you again. All right. And again, if you ever want to be a guest on the show, let me know. As you guys saw, we had a patient last week who was a guest, and her results were not made up at all. These were truly her results, and I'm extremely, extremely proud of her. So, again, if you have any questions at all, please visit bit.ly/health tea with Dr. B. You can book a consultation with me. You can find out all the teas that I've been drinking every week. This week was the turmeric ginger tea. So those my people out there who are dealing with arthritis, that lower back pain, the joint pain, the headaches, the menstrual cramps, please get the tea. This tea is for you. Honestly, I think I'm getting better because I'm drinking this tea at least every week, just so I can see how I feel. And last week's tea was raspberry tea. That tea was absolutely, absolutely amazing. Absolutely amazing. I had really great benefits from it in just 1 week when it comes to PMS and everything. So I'm telling you guys, get the tea. Visit bit.ly/health tea with Dr. B. All right, guys. Thank you all for tuning in this Wednesday afternoon. Oh my gosh, it's definitely night. So it's been a long week, guys. Thank you all for turning in for this Wednesday night podcast. I will see you all on November 1st. You guys take care and have a safe week and have a safe Halloween. All right, guys. Bye.